Opportunity to speak to you on the important topic of student mental health and suicide prevention. We discussed about mental health information as a means of preventing suicide. Now we move on to the next very important aspect, and that is about services, the logistics which are generally required to be in place for dealing with any eventuality. So we need about two to three types of services which need to be in place. And the first one is the crisis services. Most important and popular type of crisis intervention is available through a helpline. Almost every city has this facility where one or the other voluntary organization or a hospital or a college or any mental health institution or association manages the telephone service where you have someone who listens to people who are in distress. So if anybody develops any idea of self-harm or any problem of pressing psychological need, that person can dial that number. This is known as helpline or hotline sometimes it is referred to. It is very popular method for approaching to help or seeking help by a person who has difficulty or is getting irresistible ideas of killing himself or herself or taking an overdose, etc. Unfortunately, it is not very popular in our country. There are not many helplines which are, in fact, you need thousands of helplines in every city, in every place. You need a helpline where people who are trained in establishing a conversation, because it's a very important job. The job which is assigned to the counselor or a psychologist or a mental health professional who is the manpower behind the telephone is to avert an attempt. So when someone calls, the first response is to establish a repo. Many times the repo is established in silence. The person makes a call and he or she does not speak. He or she is only listening the response of the psychologist or counselor or mental health professional. Here, the skill of mental health professional is very much appreciated, because higher is the skill and capacity, much stronger are the chances of ability to prevent. Many times the clients would call up and say, hey, I'm giving you a warning, or I feel like telling you that I'm going to kill myself. And you have to speculate how much time do you have and how do you engage this person in a positive conversation. Allow him time so that his anxiety is reduced, is elevated, and he comes into a right frame of mind to consider options and alternatives. A mistake by the counselor or the psychologist or mental health professionals or psychiatric resident, a mistake may cost a life. Let me be very candid in this. It's a very high skill profession and must be taken very seriously. Unfortunately, there are no training available in our country, no organization, no degrees, no courses, nothing. And it's an area where the governments and organizations should think that why do we have such poor quality of services where the work is of life-saving intervention. These services have been professionally and academically evaluated, whether they are worth it, whether they do helplines prevent suicide is one of the question which has been addressed in academia. And without hesitation, we can say that it's a valid response, it's a valid service, and it is effective. I have the first-hand experience of starting a helpline in city of Mumbai and managing it for about 15 years. We published the data of 15,000 telephone calls, and it can be, I will give the link in one of my write-ups here, and anybody can access the information. It's very interesting to see that not always chronic patients call. Not everybody who calls up is a patient. But this is also true that many people who are suffering from a psychiatric disorder since a long time first establish a contact through a helpline meant for suicide. So a helpline of suicide becomes a gateway for offering psychiatric services. And about 13 to 14% people who approached us were the first time early intervention, requiring early intervention for mental disorders. So there is no doubt that we need quality helplines. We need periodic review of the data. We need a very good documentation of the information that we receive, because the quality of conversation which goes on between the counselor and the client is very rich. We come to know what goes on in the mind of the person. This information is not available once the suicidal ideas vanish. There is total amnesia. People forget it. In fact, doing a treatment so that people forget it is a therapeutic means often used by psychiatrists and mental health professionals. For example, using medication to reduce anxiety, using medication to put somebody to sleep leads to a kind of forgetfulness of the event, of the content of distressing thoughts and ideas. So helpline services are important services, and they must be started in all schools or colleges, because the stigma which is around mental health and issue of suicide, and stigma, unawareness, and denial, the three factors put together make this subject very complex. We know that even if somebody lives in the same building where the mental health professionals live, they do not approach, and they approach them via telephone. So it becomes a very important link, and nowadays we are moving forward in a more sophisticated manner using artificial intelligence and machine learning and various other computer-generated programs to analyze the information which becomes available by this conversation and decide the plan of action which can be, plan of treatment which can be offered. We'll continue this conversation.